Hello and welcome to imt.bme. In today's video, we are discussing an unpleasant but crucial topic: illnesses you are likely to catch in the winter, namely the flu and the common cold. Before we get into treatment, let's first talk about prevention. To avoid the common cold, it's crucial to protect yourself from the cold winter temperatures and maintain good hygiene. A good diet and regular exercise can also minimize the chances of getting sick. Our country has a temperate climate, characterized by hot summers and cold winters. Winter temperatures can occasionally fall under -15 degrees centigrade. This makes having a pair of high-quality winter shoes, warm socks, a thick winter coat, gloves, scarf, and a hat a must. It's highly recommended to wear several layers under your coat and trousers to minimize heat loss. Wearing many layers also enables you to remove some layers during the day when you feel too warm, for example, indoors at the university. The other aspect of preventing illness is to hinder germs entering your body. Ensure you wash your hands with soap and warm water after using public transportation and before eating. Using hand sanitizers is also recommended, especially if you don't have the opportunity to wash your hands. But they cannot replace warm water hand washing. Furthermore, avoid meeting sick people whenever possible. If you are ill, pay attention to meet as few people as possible so you do not infect them, and if you absolutely have to go out, wear a face mask. Against the flu, each year you can get vaccinated at general practitioners. There is a fee for this service, which you can check out on the website linked in the description. What should you do if prevention wasn't successful after all? The common cold is not a severe illness and can be easily managed. However, if not handled promptly, it can escalate into more severe diseases such as lung inflammation, brain fever, chills, and other fever and inflammation-related conditions. What are the symptoms of the common cold? Typically, it begins with a runny nose, a sore throat, maybe a headache, and feverishness, which usually ease after a few days. If you experience these symptoms, it's not always necessary to visit a doctor. Visiting a pharmacy can be sufficient. Pharmacists are trained medical professionals and can provide you with suitable medicine. Resting and drinking plenty of water or hot tea are also very important. If your symptoms worsen, you should visit a doctor. If you have a Thai card, you can find your general practitioner using the IMT website's Doctor Finder page. Your GP can prescribe antibiotics and other medicines if necessary. In most cases, you don't even have to visit them in person. It is usually sufficient to call or email them. To learn more about visiting a doctor, check out our video on the Hungarian healthcare system. The flu and the common cold often come with a high body temperature. When measuring your fever, it is important to keep in mind that there can be big differences depending on which part of the body you are taking your temperature on. For example, you will see a higher temperature in your mouth than in your armpits. In Hungary, we use degrees Celsius, and most people take their temperature under their armpits. If this is not how you do it, make sure to convert the values to degrees Celsius and point out which part of your body you measured when speaking to medical workers. If you have a really high fever, over 40 degrees Celsius measured in the armpits, you can also call an ambulance to take you into a hospital. This is not always necessary and should only be done in severe cases. After this little interlude about measuring temperature, let's get back to the illnesses. The flu is a more severe illness than the cold and is caused by viruses, making antibiotics ineffective. Symptoms are similar to a cold but more intense and can include high fever, fatigue, vomiting, diarrhea, and muscle and body aches. These days, COVID-19 is milder than it used to be and can barely be distinguished from the flu. If you experience these symptoms, it's better to seek help directly from your general practitioner, who will prescribe suitable medication. If you have health insurance, for example at the university, you can also call your insurance company for an appointment with a physician. If you have any further questions, feel free to read our website for further details or write an email directly to imt.medhelp@bme.hu, and we will do our best to assist you. We hope this video was helpful. Don't forget to like, subscribe, and get a Thai card. Goodbye, and stay healthy.